Did you know that cancer is responsible for about 1 out of every 6 deaths worldwide? That's more lives than AIDS, tuberculosis, and malaria combined. It's the second leading cause of death globally, following cardiovascular diseases. But what if I told you that oxygen, the very thing we rely on to live, plays a crucial role in cancer development and treatment? Hello, I'm Michael Grant White, founder of Optimal Breathing. In today's video, we're going to break down the complex relationship between oxygen and cancer. Let's get started. So, what is cancer? According to the National Cancer Institute, it is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. But there's a lesser known connection that could change the way we look at this disease: oxygen. When we breathe, oxygen enters the lungs and travels through our bloodstream, nourishing every cell in the body. But here's something surprising. Cancer cells also need oxygen to survive. However, cancer cells use oxygen very differently. Tumors create their own blood vessels through a process called angiogenesis to ensure they get the oxygen they need. As tumors grow rapidly, they can actually outgrow their oxygen supply. Now, you might think that would stop their growth, but that's not the case. Studies show that certain cancers can thrive in oxygen-deprived environments. Why? Because cancer cells are incredibly adaptive. Here's where the science gets fascinating. Our bodies have an oxygen-sensing mechanism to monitor and adapt to changing oxygen levels. A major player in this system is a group of proteins called hypoxia-inducible factors, or HIFs. These HIFs help the body respond to low oxygen by activating genes that promote blood vessel formation. But in cancer, HIFs can actually work against us. Cancer cells hijack HIFs to keep growing, even in low oxygen environments. Not only do HIFs help create new blood vessels, but they also change how cancer cells metabolize glucose, allowing them to survive without oxygen. This means hypoxic cancer cells become more aggressive, spreading beyond their origin and resisting chemotherapy, radiation, and even immunotherapy. This adaptation is one reason why hypoxic tumors are often harder to treat. So, does exposure to oxygen make cancer worse? The simple answer is no. The National Cancer Institute states that exposure to air will not make tumors grow faster or cause cancer to spread. In fact, better oxygenation correlates with improved survival rates. But there's more to the story. Decades of research reveal the critical role oxygen plays in cancer survival rates. Let's look at a few key studies. Over 70 years ago, Dr. Otto Warburg made a groundbreaking observation. Cells that experience prolonged hypoxia, low oxygen levels, can transform into cancer cells. This phenomenon is now known as the Warburg Effect. Cancer cells stop using oxygen for energy and instead switch to sugar fermentation. Let's look at what modern research says. A 2012 study found that rapidly growing metastatic cells can increase hypoxia levels, creating a cycle that makes cancer more aggressive. This highlights the importance of breaking that cycle by improving oxygenation. Clinical evidence shows that higher oxygen levels in tumors improve survival rates. For example, a study on non-metastatic soft tissue sarcoma patients found that patients with higher oxygen levels in their tumors had a significantly better survival rate compared to those with lower oxygen levels. Simply put, the oxygen status of a tumor can impact how a patient responds to treatment. Another pivotal 2015 study focused on hypoxia-inducible factors, or HIFs. It revealed how these factors contribute to tumor progression, resistance to therapy, and angiogenesis. This research opens doors to targeting HIFs to improve treatment outcomes. This is where TURBO EWOT comes in. TURBO EWOT, or exercise with oxygen therapy, involves inhaling higher concentrations of oxygen while exercising. By enhancing oxygen delivery and uptake, TURBO EWOT can reduce hypoxia in tumors, improve the effectiveness of chemotherapy and radiation, and potentially slow cancer spread by boosting the immune system. Based on oxygen multi-step therapy developed by Manfred von Ardenne, this therapy combines oxygen, exercise, and targeted supplementation to enhance cellular oxygenation and energy levels. So, what does all this mean for you? Understanding the role of oxygen in cancer gives us new insights into prevention and treatment strategies. Improving oxygen levels in your body isn't just about better energy, it's about better health. Let's breathe new life into the fight against cancer together. Want to know more about TURBO EWOT or place your order? Visit optimalbreathing.com today or reach us at 704-597-6775 or hello@optimalbreathing.com. Thanks for watching.